Hi, this is Joy presenting the Affordable Care Act from Mason Chapter 19. So the Affordable Care Act, this is a topic that has kind of come up in many of our other presentations, but I hope to give you guys just kind of a general overview of the Affordable Care Act. Starting with just a little bit of the history of the healthcare reform in the United States. It really started to become an issue in the 1930s. Many of our U.S. presidents have tried but failed to enact reform or unable to garner enough political support to pass legislation. It wasn't until Lyndon B. Johnson in 1965 that was able to get some reform going with the enactment of the Social Security Act and the establishment of Medicaid and Medicare. But as time has passed, the lack of comprehensive health care reform was really leading the United States into a harmful area of the cost just kept increasing, and there really wasn't a good way to measure healthcare quality. So without this reform, costs were going to continue to increase. So the Affordable Care Act was passed in 2010, and still today still remains kind of controversial. So part of the Affordable Care Act that most Americans are familiar with is related to insurance coverage, related to improving insurance coverage currently held by Americans, expanding insurance options, as well as increasing the number of Americans with insurance. By the ACA, also improvements in the insurance realm were removing of annual limits to benefits, removing the denial for pre-existing conditions, coverage for preventable services, and allowing young adults to remain on their parents' insurance until the age of 26, and just making insurance more affordable to low-income Americans by offering subsidies and tax credits to help people obtain insurance coverage. It also wanted to expand the employer-based coverage, expansions for Medicaid and CHIP, as well as some of the state and federal exchanges. Another part of the Affordable Care Act was to include payment reform for primary care as well as for nursing services. They were enhancing payments for primary care providers from 2011 to this year, 2016, trying to develop and implement a budget-neutral payment system that can be used as a payment modifier to adjust Medicare payments based on the quality of care that's being delivered, as well as testing some new payment models and primary care models, and those include things such as the Comprehensive Primary Care Initiative, Independence at Home, Medicaid Home, and a transitional model of care. The reform that was related to nursing services included using a nurse-managed health center and gaining funding to help promote those that may be able to serve as training sites for students in primary care and enhancing nursing practice, as well as providing enhanced Medicare reimbursement for certified nurse midwives that used to be 65% and is now improved to 100% reimbursement, as well as increasing Medicare and Medicaid payments for nurse practitioners, which is still a concern and is still kind of based on a state-by-state basis. The ACA included a variety of provisions to improve the performance of the healthcare system. One of those being no copays for preventative services, also establishing a law that coordinates the health care for those individuals who are dual eligible and are covered by both Medicaid and Medicare, as well as creating prevention and public health investment fund that's going to help support community and public health initiatives, as well as the home visitation. This provides funding for evidence-based home visitation programs that are supposed to help foster health promotion and illness prevention. Another part of the ACA was providing funding to help expand the healthcare workforce training and education, particularly for primary care and mental or behavioral health. That was covered very well in week 5 presentation, so I'm not going to go into too much detail here. If you'd like to learn more, just refer to week 5. Another provision of the ACA is aimed to meet the healthcare needs of the nation's population through public health provisions, which are to enhance the public health organizations on the local, state, tribal, and federal level. And the 3 main components of this public health provision are: 1, to have a capable and qualified workforce; 2, to have up-to-date data and use up-to-date information systems, as well as having public health agencies that are capable of assessing and responding to public health needs. So there are both indirect and direct impacts on nursing through the establishment of the Affordable Care Act. It was estimated that 22 million people out of about 60 million that didn't have health insurance prior to the ACA were now covered, and this created a growing concern regarding the existing capacity of primary care providers to meet that substantial and increasing demand. So they're looking for nurse practitioners to deliver high-quality health care and improve health outcomes by filling that primary care role. And to do this, they created funding for scholarships, loan repayment programs, as well as funding for nursing school programs, including advanced practice programs at the doctoral level, so that they can increase the amount of nurses enrolled and graduating with their advanced practice degree. They're also calling to modernize the scope of practice to allow the advanced practice nurse to be able to work in their full capacity of education and training. There was also the intention to create a National Healthcare Workforce Commission that was to be headed by a nurse. Unfortunately, this has not gained funding by Congress, so therefore is not being used at this time. Obviously, there is an overall cost for the Affordable Care Act. When it was signed into law, it was estimated to be about $940 billion, but with implementation changes and the Supreme Court's decision to expand Medicaid, that number has risen to $1,383 billion for the time frame of 2015 to 2024. They do have a website where you can go at the Congressional Budget Office and look at the updates and cost estimates, and I have that website listed below there. And there's also the cost to the individuals that now are using the exchanges to purchase health care coverage. There are subsidies and tax credits for those that don't qualify for Medicaid but are still in that 100% to 400% of the federal poverty level. But there are still some costs associated with those insurance plans. I listed this Bloomberg article I found that was kind of interesting, that kind of talked about the different plans as well as the actual cost of like the deductibles and actually using them and how that kind of goes together. So if you want to check that out, that's there. So there's still many political challenges associated with the Affordable Care Act. The country's opinion still remains quite divided. There are many states that chose not to go with the Medicaid expansion, Missouri being one of them. And one of the articles that you had as your supplemental reading talks about Missouri and the expansion of Medicaid. And then there's also an article listed in the reference slide that was from the Post-Dispatch that discusses Missouri in particular and the expansion of Medicaid that are kind of interesting, so if you want to check those out. But the lack of the Medicaid expansion really affects those in the rural communities that are more likely to live in poverty and less likely to have these employer-sponsored health coverages. And if, the states that do not expand their Medicaid is going to still leave many without being able to obtain health care coverage. There's also some political challenges regarding large businesses that may use religion to opt out of mandates, such as Hobby Lobby using religion to opt out of the contraceptive mandate. And then there's still a lack of confusion, lack of education, creating confusion with the American population regarding the Affordable Care Act. They did a poll that was asking, are they in favor of the Affordable Care Act? Do they wish that it be repealed? And when they called it the Affordable Care Act, it got 61% that says they were either in favor of it or wish that only maybe small changes be performed. And then they did the same poll but called it Obamacare and got only 36% of the respondents felt that the law was a good idea. So just using different terms, one calling it the Affordable Care Act and the other calling it Obamacare, still shows that the American public just really doesn't understand exactly what it is and how it can be used to help better their health care needs. So that concludes my kind of general overview of the Affordable Care Act according to Mason Chapter 19. This is my reference sheet. There are those links to a couple of those articles that I mentioned if you would like to check them out. And thanks for listening to my presentation.